Welcome back to another episode of the Future Cities podcast. I'm your host, Stephen Elser. As you're well aware, we are in the middle of a global pandemic. Things are especially bad in cities, which is not particularly surprising. For all the good things that cities do, they are vulnerable to pandemic outbreaks. Cities serve as ports in our increasingly globalized world, with people and goods from all over the world passing through our major cities every day. Cities also tend to pack people together in tight spaces, in apartments, on the street, on the bus. So how do things change in cities once a pandemic takes hold? Today we'll be talking with a group of experts about what this pandemic means for our public health systems, critical infrastructure, the research being done in cities, and ultimately, urban resilience. COVID-19 has thrown a wrench in just about every aspect of our lives, including the ways that we as urban researchers think about extremes, the systems that we study, and how we must better prepare for more events like this.
COVID, I think, is turning upside down how we think about criticality, and it's interesting to think about, what that might mean for how we define critical infrastructure in the context of other extreme events going forward.
We need to think about the game changers. Game changers are things you didn't expect, and they just throw a curveball at you, and you're trying to deal with it. And this is exactly what this is, and not something that we had any real intellectual energy that went into before it happened, before it sort of happened to us.
I think the question now is, in the context of complex cities like New York, but also many other cities across the US and the world, is are we also prepared to protect the most vulnerable that may be facing multiple extremes simultaneously?
So this episode is going to be all about urban resilience in the face of COVID-19. What transformations has this pandemic already caused? What systems are failing? What aspects of our complex systems must change in order to bring about more positive futures? What can we do to return to any semblance of normal, or have we already passed a tipping point into a different state entirely? We'll start the episode with a recording from the recent Urban Resilience to Extremes Sustainability Research Network's virtual all-hands meeting earlier this month. This meeting was supposed to be in person, but like so many other meetings and conferences, it had to be moved online. And while COVID-19 wasn't originally going to be a focus of this meeting, the executive team felt that it was necessary for us to dedicate time to thinking and reflecting on what this pandemic means to urban resilience, the research that we're doing, and the communities that we aim to serve. You're about to hear a reflection from Dr. David Eisenman. He's a professor of medicine at the David Geffen School of Medicine at UCLA, as well as a professor of public health at UCLA. Here he is.
We've all been pondering how resilience applies in COVID-19. Because of the research I do, when I think about resilience, I think first about networks, social networks and organizational networks. Of course, many of you immediately know the problem. In this pandemic, social isolation is rampant and required. Our world is all about relationships, but how do we hold on to them and the hope they give us when there's no real contact? How can we be good helpers when we are under as much threat as the people we want to help? Social networks have a difficult time penetrating through social distancing. Providing face-to-face help imperils the helped and the helper. I'm accustomed to planning and building for resilience before the disaster hits. Now we are in the midst of the disaster response. Everything is happening too shockingly fast. A blizzard of pre-publication papers, news stories, blogs, and tweets about COVID-19 cover me daily. It's hard to say what I know for sure. 3 weeks ago, on national media channels, I advised the public against wearing masks. Now I am learning about asymptomatic spread through just talking. It appears that normal speaking produces microscopic spit droplets that contain the virus if spoken by an asymptomatic carrier. Putting masks on everyone to stop the spreaders from spreading is gaining support. Looking for resilience, what do we find? We see sizable shoots of resilience poking through this blizzard-covered land. We see emergent global communities among scientists and policymakers. We've seen a staggering amount of learning in just a few months, aided by open science. We see the pro-social behaviors. Philanthropic giving is up. Anyone who sews is sewing masks. Every other engineer and mathematician is coming up with a model. We see social distancing measures that were partially followed when they were only recommended, and that needed to be mandated to reach a level likely to succeed. On the other hand, I am cautiously optimistic that our social distancing is helping. Numbers of fevers may be dropping in many regions of the country due to social distancing. Seattle reported slowing rates of coronavirus deaths. Californians and Angelenos reduced their mobility over 45%, earning an A rating on the Unicast scoreboard. We are part of the most immense public health program in modern times, and everyone's participation is counting. So what is it like to be responding to this pandemic? Someone I follow on Twitter put it this way, quote, "Let me be frank, there are no COVID-19 experts. Those of us responding to this pandemic are simply doing our best to bring our own disciplinary experience to address this problem," she said. Our local leadership in California has been fantastic, but my previously esteemed CDC has remained on the sidelines. It has suffered a hit to its reputation despite the hard work of people like Dr. Nancy Messonnier and Dr. Anne Schuchat. The CDC's messaging has been confusing, the reasoning opaque. The absence of any CDC-led effort to collect, analyze, and disseminate state and local data is astonishing and embarrassing to me as a US public health scientist. This crisis raises fundamental questions about whether the CDC can meet its core responsibilities to the US. Well, resilience is forward-facing. What are the prospects for our recovery, for transformation? We must endure social distancing and increasing hospital capacity until we can manage any hospital surge, while continuing the global scientific collaboration in search of a vaccine and therapeutics. We need widespread testing and disease surveillance now. But broad-scale social distancing is a blunt tool. It is causing a massive social and economic crisis, and certainly worsening health in other ways. Once we have widespread testing, we will need widespread contact tracing. We will have to rebuild our public health workforce to do this. But on its own, this is not a resilience approach. I'm interested in what Trevor Bedford, a computational biologist in Seattle, calls a digital participatory contact tracing system. If someone has COVID-19, they register with an online platform which, using cell phone data, warns other individuals who are possibly exposed to seek testing. Ensuring that this data is secure and privacy is preserved is obviously of paramount importance. But this is a potentially more resilient system. Rebuilding hierarchical reporting systems based on state and locally funded workers is rebuilding a fragile system. Disaster researchers know that the money flows after the disaster, and then we quickly forget. Public health emergency preparedness as a field lurches from one disaster to the next, with investments inversely proportional to the time since the last event. In the years since 9/11, we built US public health emergency capabilities, and then we starved them of dollars and let them wither away. There will be other pandemics in the future, including pandemic influenza. We need solutions that are scalable and resilient to the vagaries of public health funding. No one knows what will come out of this crisis. Rebecca Solnit reminds us that disasters often shake loose the old order, leading to a new sense of who we are and what we can be. This is the heart of the resilience mantra: bounce forward, build back better. Thank you.
As Dr. Eisenman said, resilience is forward thinking, and that in the face of extremes like the COVID-19 pandemic, we must bounce forward and build back better. Of course, that's easier said than done, particularly when you're thinking about the increasing likelihood of our cities facing multiple extremes at once. So, in the Northern Hemisphere anyway, summer is fast approaching, and that means hurricanes and heat waves. And we know that climate change will make these sorts of extreme weather events more frequent and intense, but now we're being forced to deal with those weather events and a pandemic at the same time. How will the way that we deal with this pandemic change when another extreme is added to the mix? Are populations vulnerable to heat and flooding also more vulnerable to COVID-19? Our next conversation is between Dr. Bernice Rosensweig, who is a research associate in the Environmental Sciences Initiative at the City University of New York, and Dr. Timon McPherson, who's the director of the Urban Systems Lab at the New School. They'll talk about some of those questions, as well as what challenges the researchers have needed to overcome in order to continue doing their work during this global pandemic.
Let me go through where we are today on the numbers, just to give people an update. The number of cases still going up. We're all in search of the apex and the other side of the mountain, but we are still headed up the mountain.
So that was a clip from one of the daily briefings by Andrew Cuomo, the governor of New York State, on March 31st, 2020. That afternoon, I interviewed Dr. Timon McPherson, the director of the Urban Systems Lab at the New School in New York City. Dr. McPhearson is also an associate professor of urban ecology and research faculty at the Tishman Environment and Design Center at the New School, and a research fellow at the Carey Institute of Ecosystem Studies, and an associate research fellow at the Stockholm Resilience Center at Stockholm University. He studies the ecology in, of, and for cities to advance resilience, sustainability, and justice. What type of work does the Urban Systems Lab in New York City primarily do?
So the Urban Systems Lab is an interdisciplinary research space within the university. And I say that because one of our core goals is to bring together experts from different backgrounds to look at the interdependence of social, ecological, and technological infrastructure systems in the context of cities. And to look at that interdependence in the way in which it drives persistent challenges like inequality, like vulnerability to climate change, but also as a way to try to understand how we can develop systemic solutions. Because I think the sort of core principle within the Urban Systems Lab is that we work and live and are challenged by and develop solutions within the context of a system and a complex system, and that to really understand that system in a way that we can develop solutions that are lasting and that reduce a lot of these sort of externalities that come with certain kinds of piecemeal solutions, that we really have to look at them in a more systemic way. So overall, I would say that's like the broad brush of what the USL is trying to do. But more focused is that a lot of our work is around climate change resilience and really trying to understand the impacts of climate change, who is being most affected, what kinds of strategies can help reduce vulnerability and risk to climate change in cities.
Right, and so a lot of our work has been collaboration as part of the Urban Resilience to Extreme Sustainability Research Network project, or the URXSRN, where we focus on extreme events, usually extreme meteorological events like extreme rain or storm surges, and how those act as disturbances to urban ecosystems. A pandemic is very different than the type of work that we usually focus on. So what type of research are you and the Urban Systems Lab doing in response to the pandemic?
You're right. The pandemic is very different as a challenge than, say, an extreme rainfall event or the way in which New York City dealt with and reacted to Hurricane Sandy in 2012. On the other hand, there are interesting similarities depending on the kinds of question you ask. So what we're asking as a starting point within the Urban Systems Lab is where are the overlaps and what we think is going to emerge as interdependent risks between who's most at risk from this pandemic, from the coronavirus, and who's also at risk of extreme flooding or extreme heat. So the fundamental question that we're trying to ask, and we're just getting started on this, is what do we need to prepare for as the coronavirus continues to evolve and wreak havoc in what has emerged as the global epicenter in New York City of impact so far? And how will that evolve in the context of changing weather patterns and potential climate-driven extreme events? And the reason we're asking that is because a relatively simple observation, one we're making, but I think others will soon kind of see the value of this, is that elderly populations, low-income populations, a lot of the populations that sort of fit into a classic social vulnerability category when we think about it from a climate change risk perspective, are also ones that are being affected most by this epidemic, or rather pandemic. So that's really what we're trying to understand is, what does it mean when you add up vulnerability to COVID-19 and vulnerability that already exists to other kinds of climate threats? And then what does that mean if we have to deal with these simultaneously? And I think this is really important, given that we're in some ways lucky that the pandemic and the way in which it's been spreading across the United States and hitting New York City didn't happen in the middle of a harsh winter where we're at potential loss of power outage and extreme events from snowstorms. On the other hand, we're moving into a rainy season in the spring and a potential very warm summer, if the last couple summers have anything to say about what the next summer is. And when you look at the models for how long we may be needing to shelter in place, to have social distancing, things that really dramatically change human behavior in the city, then this takes us into the midsummer in New York. And so for us, there's so many questions to ask right now about how to deal with and create methods to flatten the curve and reduce total exposure, the number of cases and number of deaths. But the question that I think we haven't asked yet, both as scientists or as policymakers and decision makers, is what do we need to be preparing for as the weather shifts, and the kinds of interdependent risks that exist in the system but haven't emerged yet for us to actually see.
How can this research be used to support the pandemic response operations right now?
Well, I think that in terms of the emergency response, it's not relevant yet. But the question is, do we need to have plans in place for how, for example, New York City is considering street closures in order to open up more pedestrian pathways so people can get out and walk around outside safely? What that might mean in an extreme rainfall event that could happen today or could happen a month from now, and hopefully won't happen at all in this crisis period. To look at transportation corridors, to look at the way in which people may be affected depending on who's going to be more vulnerable to that kind of event. Similarly, if we think about it in terms of a potential heat wave event that could happen as early as May, may not happen until later, hopefully in the tail end of this coronavirus process. But there's similar questions to ask that the science there, I think, should be informing the way in which we develop emergency responses that need to be planned now in ways that so far haven't been articulated as being planned.
And long term, how can this type of research be used to help us better understand urban systems in the future?
Well, I think this pandemic has helped to sort of shine a light on the need to understand the complex ways in which pandemics can happen. And what we're hoping to do is use our research to shine a light on the interaction between the impacts of pandemics and the impacts of climate change, both of which are part of our future in some way. The future is certainly uncertain, but we can, I think this particular event tells us that we need to be better prepared for potential pandemics, and past climate-driven extreme events have taught us that we need to be better prepared for climate change. What we haven't done is really brought these two together. And I think that's perhaps an important area of new research, but certainly an important part of resilience planning. If you look at resilience plans that have been developed, they're largely driven by the need to respond to climate change. But now we know, and epidemiologists and many other scholars have been saying this for a very long time, that we need to be better prepared for pandemics. I think the question now is, in the context of complex cities like New York, but also many other cities across the US and the world, is are we also prepared to protect the most vulnerable that may be facing multiple extremes simultaneously?
And so this is new for all of us. What challenges have you had to overcome to conduct this research while all of this is going on?
Well, I think we're handling the same challenges everyone is, which is how do people focus when they're distracted by things that no one would call a distraction, like caring for family members and friends, and additional dependent care and responsibilities, and that in most cases, all of our researchers in the USL, their workload has gone up. So how do you add an additional set of research responsibilities to that? On the other hand, I think people are looking to be meaningful. Some of the USLers are volunteering to deliver for people who can't leave their homes. They're doing all sorts of things to be active and support their communities. But another skill that the research community has is to help advance the science to better prepare for these kinds of resilient strategies to be deployed in emergency response or in a planning or a policy decision. So I think for us, on the one hand, everyone is feeling overwhelmed. We are just like lots of others, and many of our USL researchers are in small New York City apartments that and sheltering in place as they should. On the other hand, I think there is an increased motivation to make your work relevant, and so we're seeing an opportunity here for us to do something that's meaningful, even though I think we could all argue that everything we've been working on, we all have thought is meaningful. But in the current moment, for this to be meaningful, it's helpful for us to create some space to do some work that relates to the current crisis. And in this case, I think it's actually, to some extent, excuse me, almost an adaptive strategy as a researcher to shift your work in an area that can apply to the current moment, given most of our headspace all day long, in some cases all night long, is thinking and dealing with this crisis. So for us to apply our skills in that direction, I think is something hopefully we can do something meaningful and useful, and also bring some meaning to the difficulty of all of our daily lives right now.
Well, thanks so much for taking the time to do this interview. And I hope you stay, of course, safe and healthy through all this.
You too. And to everyone who's listening, the same.
As Bernice and Timon discussed, it is absolutely essential for us to better understand the ways that COVID-19 interacts with other extreme events that cities are likely to face. Without this knowledge, already socially vulnerable populations will be left more exposed and at risk. The pandemic is also impacting people in a less direct way due to the critical infrastructure that we rely on in cities. Transit systems, parks, as well as the supply chains for grocery stores have been totally upended by this pandemic. In our next conversation, Alysha Helmrich and Dr. Mike Chester, both of whom are in the School of Sustainable Engineering and the Built Environment at Arizona State University, discuss what COVID-19 means for the critical infrastructure in our cities and what sorts of information that infrastructure managers should be considering in order to prepare for other pandemics and extreme weather events.
Hello, everyone. My name is Alysha Helmrich, and I'm a graduate student at Arizona State University, studying sustainable engineering and looking at how infrastructure engineers approach their design so that infrastructure can become more resilient. And our special guest for today is my advisor, Dr. Chester. Mike, could you introduce yourself to our audience?
Happy to. Yeah, Mike Chester. I am on the faculty of Civil, Environmental, and Sustainable Engineering within the School of Sustainable Engineering and the Built Environment at Arizona State, and on the executive management team of the UREX SRN.
And today what we are talking about is COVID-19 and its impacts on infrastructure systems. And this might not be what's on the forefront of a lot of people's minds. They're thinking a lot of critical infrastructure as the critical employees who are working there, but not so much the infrastructure itself in a physical sense. To start us off, how do you think COVID-19 is changing our definition of critical infrastructure?
Yeah, good question. So I'll start by giving kind of my framing of infrastructure for the sake of this conversation. So when I'm talking about infrastructure, I am predominantly going to mean gray infrastructure or engineered infrastructure, but fully recognizing that we in the SRN and our community take a broader definition. So when I think about this question of how COVID is impacting how we define or think about what critical infrastructure mean, I start with, what definitions do we have of critical infrastructure? And the most prominent one is that by the Department of Homeland Security, which is largely what we in the United States use, because that flows down to states, regions, and so on in terms of how they define what's critical. But DHS has traditionally defined critical infrastructure in a very kind of sectoral way, right? So it has things like power and water systems in there, transportation systems in there, healthcare, certain industries, for example, certain manufacturing sectors, and so on. And that framing has been used to prioritize resources to prepare infrastructure against particular extreme events. Of note are things like terrorist attacks, but even to some extent, extreme weather-related events. So when COVID comes along, it's interesting because, COVID attacks infrastructure like it attacks everything else somewhat holistically, right? There's no particular place that is safe or less safe from, the effects of COVID. So, the way in which we think about criticality, I would argue, has to change, right? So the idea that, these sort of traditional sectors that we might think about in terms of protecting in a kind of warfare sense, now all of a sudden have a different light because, what is happening across our society is radically shocked, seemingly over the course of a couple of weeks. Some of the context here is, when we think about infrastructure, we think about how it's used. And, one of the things that we're seeing with COVID is that we're seeing shocks in terms of both supply and demand, so, how we demand services for it. So all of a sudden, over the course of, 2-3 weeks, we're no longer driving, for example. So we're seeing the effects on transit systems and even automobility and fuel prices all of a sudden get shocked. We're not going out to restaurants. But on the flip side of that, right, we're seeing us use Zoom and telecommunications on, a factor of 3, 4, 5 times the scale. We're relying on supply chains and grocery stores in ways that never had. So as we think about criticality here, I would argue important to think about what it is that we want our infrastructure to do, not simply which infrastructure sectors are more or less important. And COVID, I think, really highlights how there's certain human capabilities, is the term I would use, that, we need to ensure here. Of course, things like shelter, and COVID is attacking health, right? And those are kind of capabilities that we want to maintain: food, access to energy and water, and so on. How we think about capabilities really in light of COVID relative to anything else is really, I would say, challenging how we think about what criticality means in the context of infrastructure. So a great example that has come up is that of parks. So we're seeing in many places across the country that parks have become places where we have homeless communities. And as COVID has taken hold, what we would traditionally do is push these homeless communities towards shelters in the name of public health. But in doing so, there's problems with social distancing. We run the risk of increasing the sort of infection rates of COVID. So we have actually said in many cities across the country, let's make parks critical in the sense that we want to provide them with resources, maintain the homeless population there in a somewhat healthy way. Similarly, we're seeing parks being used, for people getting exercise. Now, all of a sudden, your sort of mental well-being is tied to a piece of infrastructure that normally wouldn't be deemed critical, but now all of a sudden is. COVID, I think, is turning upside down how we think about criticality. And it's interesting to think about, what that might mean for how we define critical infrastructure in the context of other extreme events going forward.
So Mike, you began to bring up these ideas that COVID is attacking infrastructure indirectly, and this is very different from what we've seen with other disturbances, as you mentioned, of terrorist attacks and extreme weather events. And one sector in particular that is seeing this is the public transportation sector. It's operating here in Tempe, Arizona. We have large buses that are now operating, even though very few people are riding, so that people can socially distance. But the schedule's still going on, and there's a lot of money going into disinfecting these spaces as well, so that these populations that need this sort of transportation still have access to it. How do you see this sector adapting and managing the situation they are now in?
When we have thought about the impacts of extreme events and particular hazards on infrastructure, we've historically emphasized the direct effects. And so by that I mean, we've emphasized how these hazards, whether it's an extreme climate-related event or something like a terrorist attack, or even, the issue of disrepair, actually knocks out the physical assets themselves, right? And there's a lot of knowledge and insights around how that happens. What's unique about COVID, or at least what's different about COVID, is that it impacts infrastructure in an indirect way. So the virus doesn't directly affect the physical asset. It instead impacts people, which of course are the foundation of everything that has to do with infrastructure, from not only how infrastructure is used and how services are demanded, but also how it's maintained, how it's built, and so on. So what's particularly interesting to me is at the onset of COVID, roughly in the past weeks to month, what we've seen is that the physical assets of infrastructure are just fine. That won't always be the case, but for now they are. For the most part, the roads are fine, power lines are fine, water pipes are fine. What's at issue is the challenges of, one, who's available to continue to, maintain these assets, how we operate these assets. So we're seeing issues around, for example, social distancing and sending crews out to do repair work. We're also seeing issues around maintaining social distances while ensuring that your sort of command and control hubs of certain infrastructure are properly staffed and operating as they should. On the other side, right, we're seeing the effects of, a shock in demand, right? So when we talk about something specific like transportation, it's interesting, right? Because transportation has a number of different ways in which you could, think about services. The first is passenger services. So Alicia, you brought up, for example, public transit, right? And there's obviously automobile travel and personal mobility. But when we look at those services, right, the shock demand has largely been cut off, right? We're not asking for, people are not demanding that, they use these services in the same way. Personal mobility has been largely shut down as we stay at home. There's the other side, which is the goods movement side, right? And that has been shocked in a different way, right? And that's sort of, your Amazon kind of supply chains and need to deliver goods to people's houses, groceries in ways that, grocery stores have never, had to deliver groceries to home in this way before, right? So we're seeing, these events play out on both sides of what I would describe as supply and demand as it relates to the engineered infrastructure. What's particularly concerning to me is over time, if COVID persists for, say, a year or longer, then we're going to start to see both the effects of, the need for, standard maintenance and long-term rehabilitation, coupled with our sort of inability to operate under business as usual models of how we maintain and rehabilitate. So what I'm starting to think about and sort of engage with some infrastructure agencies on are questions related to, if you have kind of major needs around, maintenance and rehabilitation, if we enter a period where, for example, in the summer in Phoenix, extreme heat events are taking hold and power system demand is really high, and all of a sudden you've got to send out your sort of peak demand crews, but you're unable to do it under kind of COVID-like conditions with, social distancing and the need to protect your staff. You'll probably have staff members that have COVID and are, quarantined. Then, how do we operate, right? How do we sort of shift our model of thinking and model of actually doing towards, one where COVID is with us for the long term versus how we've planned under what I would describe as normal extreme events circumstances.
So you've brought up a lot of different challenges that COVID is bringing to infrastructure systems. We have this redefinition of criticality. We have concern about concurrent hazard events. There's also how are we just simply going to manage throughout this time? With all these different challenges emerging, what do you think one big takeaway from COVID-19 will be for infrastructure managers?
I think it's going to be the challenge of recognizing how you respond to rapid changes in conditions when your systems have been designed largely to move fairly slowly and somewhat rigidly. So we often talk about extreme events or even sort of Anthropocene type shocks, whether it's emerging and disruptive technologies or rapid changes up and down of financing of infrastructure. So we talk about a number of different variables that, seem to be increasingly uncertain and accelerating. What COVID has done for me is shown just how rigid our infrastructure systems are in being able to adapt quickly to rapid changes in their environment. And I think a lot of the lessons that or a lot of the kind of theory and ideas that we've been advancing in the SRN are quite applicable here. The other side of it is that, the question of should an infrastructure agency have been able to have the foresight to seeing a COVID or COVID-like event come and be prepared for it, I think is a really interesting question. So, when it comes to something like climate change, we would say absolutely, an infrastructure agency should be able to, have plans in place and resources and resilience capacity to, be ready for and respond to a hurricane or extreme heat event or a flood. When it comes to something like COVID, is that fair game as well, right? What should an agency have in their portfolio of shocks, of perturbations that they should be able to deal with, and what shouldn't they? And if COVID is something they shouldn't have in their toolkit, then why not? And who does, so that, when the shock happens, they are able to go to the appropriate agency, whether it's a regional agency, a state agency, a federal agency, and say, what do I do now? How do I keep my head afloat, keep power going and water going and mobility going and so on, because we don't have any of the expertise or capacity to do this. So, we think of this loosely as, sense making of your environment. And, I think it's worth asking the question of, whether or not an engineered infrastructure should have the ability to make sense of a pandemic versus anything else.
Thank you, Mike, for your time. We really enjoyed having you here on Future Cities.
Thank you. It's been a pleasure and happy to be part of the conversation.
I think that Alicia and Mike discussed a great point about what infrastructure we consider to be critical has changed because of COVID-19. I think this point highlights the importance of having a diversity of infrastructure types in our cities. So as Mike mentioned, parks are now a form of critical infrastructure, being used to help homeless communities as well as providing a place for people to exercise. If these parks and other open natural spaces like them didn't exist in cities and all we had were the homeless shelters and the gyms and these other enclosed structures, then we wouldn't be able to react and adapt to this extreme as easily. So in this way, having a diverse portfolio of infrastructure types has made our cities more resilient to this kind of extreme. We'll wrap this episode up with a conversation between myself, Stephen Elser, and Dr. Nancy Grimm, who's a professor in the School of Life Sciences at Arizona State University. You may remember her from our earlier episode, Defining Resilience, where Nancy shared her perspective on resilience as an ecosystem ecologist. In our conversation for today's episode, we'll discuss how COVID-19 compares to other extreme events the cities face and what this event could mean for urban resilience down the road.
Yeah, I'm Nancy Grimm. I'm a professor at ASU in the School of Life Sciences, and I'm an ecosystem ecologist who studies cities and streams. In the Urban Resilience to Extremes Sustainability Research Network, which I co-direct, we are focused on how we can help cities to become more resilient in the face of the increase that we are going to be seeing in the future of extreme events owing to climate change. And increasing resilience has a lot to do with shoring up our protective infrastructure. That's probably what everybody thinks of right away, but it has a lot also to do with working on our social dynamics, our social system, the kinds of institutions that we have that govern our responses to these kinds of extreme events and help us to prepare for them. It also has a lot to do with thinking about these urban systems and infrastructure in a more inclusive and interdisciplinary way. So thinking about not just the stuff, the technical built infrastructure, but also the people, as I said, and also the natural environment and the ecosystem that represents the city. And so the nature parts of that. So I'm interested in that. And then a lot of what I'm also focusing on, which is a big part of the Urban Resilience Project, is the future that we can help to envision with people who are making decisions in cities at various levels, the kinds of futures that would make our cities more resilient to these coming extreme events. And so we really are focusing on thinking about the future and how we can change or transform our cities now to make them more resilient in the future.
Thank you. So you mentioned the main focus of this, the Urban Resilience to Extremes project is extreme weather events, right?
Yeah.
But through the course of this network, our network cities have experienced a whole range of extremes, weather related or not. So Hurricane Maria, obviously, the extreme weather event that caused a lot of damage in San Juan. But we've also saw civil unrest in Valdivia, Chile. We've had heat waves in Phoenix, and now we're experiencing this new extreme of this pandemic. So could you talk a little bit about how you see this extreme event of the COVID-19 pandemic and how it compares to other extremes that cities face?
Well, I would love to talk about that, and I've been thinking about it a lot, as I think we all have. But it doesn't compare at all. This is not something that we had on our radar at all, except for the sense that I would say when we first started this project, Chuck Redmond said we need to think about the game changers. Game changers are things you didn't expect, and they just like throw a curveball at you, and you're trying to deal with it. And this is exactly what this is, and not something that we had any real intellectual energy that went into before it happened, before it sort of happened to us. And so what's amazing about it is where a lot of the extreme events that we've been focusing on are very localized. They'll hit a city. So you said heat wave in Phoenix, Hurricane Maria in San Juan, Hurricane Irma in Miami. They're hitting these cities, and it's a big deal for sure. But this pandemic is, it's widespread, and everybody's affected by it. I mean, worldwide. It's very amazing that way. And now New York City has really gotten the brunt of this in the US, but at the same time, all of us are affected by it, and our lives are changing in really big ways. So I think that that's the first thing, is that it's not something that I think is comparable But it does have some important similarities. So the fact that we have this event that came on really rapidly, and that's going to have a long tail. So what I mean by a long tail is it's going to take a really long time until if we ever do get back to a semblance of sort of the life that we expect that we're going to be living. And potentially we won't. I mean, potentially we will make, in some aspects of our lives, we'll make real transformations. So some of the things I think that are quite interesting about it is for the question of social equity, which is a big concern that we have in our work on resilience, that in trying to build resilience, that we're doing this in a way that's equitable and fair. What we find is that although the pandemic it doesn't really care who you are. If you get exposed, you're gonna, you have a high potential for getting this disease. At the same time, the structures that we have as sort of racist structures that we have in this country make it the case that people that are more exposed happen to be people that are poorer, more people of color, and so forth. So that's one thing I think that's really, yet again, there's this sort of history of racist policies and so forth that are coming back to hit us. In terms of ecological systems, I think what we're seeing is really fascinating, that there's some rebound. So you hear about Beijing, which has one of the worst probably the worst air quality in the world, having clean air all of a sudden, reduction in noise pollution without all the cars and machinery and so forth going on. I saw a piece that's suggesting that birds are changing their songs in the light of this. So improved air quality, improved sound quality, improved water quality in Venice that can actually see through the water at this point, expanded habitat for animals. Also this idea that people are getting out more because they're stuck at home, so they go out and walk a lot more. So there's a lot more use of local nature, parks and things like that, perhaps overuse in some places. But these become really, really important areas for the well-being of folks who are trying to get through this, potentially an improved experience of nature and so forth. I probably wandered off beyond what you asked, but some reflections on that.
No, that was really great. That's perfect. And it leads pretty well into this last question I had. So you're talking about the possibility of transformation, both in terms of our social structures, as well as we're seeing some shifts and rebounds in the ecological systems within our cities. So I guess in thinking about transformations, how do you think this event will actually shape the short and long-term resilience of cities?
I don't have a crystal ball, so I can't really say. But I think it would be interesting for us to actually try to manage that transformation. I mean, we are in a transformed state right now, right? So people are working from home. Those that can are working from home. And that is in itself a transformation. I am not taking those 6 airplane trips that I was going to take. In fact,
right.
Not many people are taking airplane trips. And that's a transformation. So we're seeing a transformed system where it's responding to that. But the real question is, can we maintain that? Can we pick the good things that are happening and make them persist? So will companies learn that their employees are just as productive when they're working from home as they were when they came into the cubicle? And if that's true, then maybe you'll see a lasting impact of this on the way that we work. And so maybe employers will actually see that that having people work from home is a good thing. And then that becomes a transformation in, in the transit system, and the amount of cars that are on the road improves the air quality, and contributes to the reduction of greenhouse gases, which can start to do a little bit, but an important little bit towards reducing greenhouse gases and slowing down climate change.
So I want to jump
Yeah,
in
please.
a thought that I had. Yeah, so thinking about, if people just start working from home now as a new normal after all of this, and as you say, there are fewer cars out on the road and whatnot, it also opens up the possibility of totally restructuring some of the infrastructure in our cities. So like making streets more, like getting rid of lanes for cars and making them purely pedestrian or purely bike, or putting in more trees, more soft green infrastructure systems that don't support cars, since you won't necessarily need as many cars if everyone's working from home. So yeah, there's this very positive thing that could happen if this current transformation really takes hold.
If it takes hold, and I think that requires some actual management or push from society to make that happen. But the other thing to note about that is that this vision that you're talking about, with roads being scaled down for traffic and increased for human walking and bicycling and things like that. These are visions that are actually in many of our scenarios for the future that we've done in these 9 cities. And it'd be interesting if some kind of a shock to the system like this one was the instigation to actually make that change happen.
All right, well, those are all the questions I had for you. So thank you so much for taking time out of your day to do this.
You're very welcome.
From our conversations today, we learned about some of the failures of our current systems that the COVID-19 pandemic has exposed. We also discussed some of the complications that the pandemic presents when it will interact with other extreme events. While much of this is scary, it is possible for us to adapt and transform in order to achieve a positive future despite these challenges. As David Eisenman said at the beginning, bounce forward, build back better. All right, that's our episode. Big thanks to everyone who helped put the episode together, in particular Bernice Rosensweig and Alysha Helmrich for conducting those interviews, and a big thanks to our 4 guests, David Eisenman, Timon McPherson, Mike Chester, and Nancy Grimm. They're all such generous and smart people, and we're very lucky to have them share their perspectives with us. Thanks so much for tuning in, and we hope that you're staying safe. Here's a haiku to take you out. COVID changed the game. We must transform our cities and build back better. The Future Cities podcast is an outreach effort brought to you by the Urban Resilience to Extremes Sustainability Research Network, or UREX as we usually refer to it. To learn more about UREX, visit www.sustainability.asu.edu/urban resilience. If you have any questions, feedback, or suggestions for future episodes, you can email us at futurecitiespodcast@gmail.com or find us on Twitter at FutureCitiesPod. If you enjoyed the episode, please rate and subscribe to us wherever you get your podcasts. See you next time.